right, it's time for our weekly pandemic checkup with Santa Barbara County Public Health. Dr. Henning Ansorg joining us. Thanks for being here, sir. Let's start with vaccines. It seems pretty obvious they're working. The U.S. is at a 7-month low for new cases. Many parts of the world remain on fire where they don't have the vaccination program we have here. Locally, 42% of Santa Barbara County now fully vaccinated. 59% have at least gotten a shot of those who are eligible. How do you reach those that are still skeptical?
Yeah, I mean, the numbers are good. They're just not quite good enough. Our bar is a little bit higher than that, 61%. That's like the latest because, I mean, we're vaccinating over, 1,000 people a day. So the numbers go up fairly quickly. So if we are at almost 60% who had at least one shot of everybody who could get it, these 60% have already very good protection. We want to go towards 75% to reach the, elusive herd immunity. And just because we have these good vaccination rates in California, we see a huge improvement in California. California has the lowest case rates in the country. So, and I think it speaks for the vaccination effort.
People are getting vaccinated. People are thinking about getting vaccinated and say that they most likely will. What about natural infection? Does that help us at all in reaching, this herd immunity that we're trying to get to?
Yes, it does. We rely on that as well. What we do not know is how robust the immunity remains even when variants come into play. We do know when the virus changes that our vaccines are very protective. So therefore, even if somebody had COVID before, we strongly recommend to still get the vaccine because it will just make the immunity against coming changes in the virus much more robust.
All right, so happening right now, you guys are partnering with UCSB with a vaccine clinic. Our cameras are there. We'll put up the live pictures. How have vaccinations been going on college campuses?
Well, this is new. This is first, and I'm very excited about that because it's hugely important. Currently, the new cases that we see are basically from kids, from teenagers, and so people in their teens and in their 20s. So that's where our efforts are going to go now, to university campuses and then to schools.
The FDA is expected to approve the Pfizer vaccine for 12 to 15, so right in that age group where we're seeing the spike. Could happen as early as next week. Any concern with giving it to younger teenagers? There's a lot of questions about fertility that are floating around there, especially among women and young girls. Do we know anything about that?
Yes, we do. There's absolutely no evidence that it affects fertility later in your life. That is a hoax that has been, going around on social media. It has been completely debunked. There is absolutely no validity to this. Women who were in the trials, we've given it by the millions now, have successfully become pregnant. There's absolutely no evidence that there's any truth to that. So teenagers and parents should not be afraid at all about any effects on fertility. It's super important to protect the young folks, and they will play absolutely big role in getting us to herd immunity. Without them, we can't do it.
Right, and they're all heading back to school right now. There's new data from the Department of Health and Human Services that shows that younger unvaccinated people are what's driving new infections. Just last week here in the United States, 12 to 17-year-olds had the highest increase in the positivity rate of COVID tests. Is that something we're seeing in local schools as well in Santa Barbara County?
Absolutely, yeah. Over the last month or so, we had 50 outbreaks just in schools. And so, yes, the highest percentage of people with new COVID positivity are the under 18-year-olds in Santa Barbara County. The next group is the 20-year-olds. So, yes, college kids, school children, they are really, really our next frontier to get vaccinated. And yeah, as you mentioned, the FDA will very likely approve next Thursday to have 12 and up vaccinated, and in short follow-up slated for September, children over the age of 2.
Yeah.
So that would be big, because many children don't get super sick, but some do. And we've had deaths of teenagers from COVID. So that's scary. We want them covered. We want them protected.
And then finally, it is Mother's Day coming up. You have your pink tie on. I have my purple tie on as we're getting prepared. If you've been vaccinated, what are the guidelines getting together for this weekend? A lot of people didn't see Mom last year because we were right in the middle of the worst of it. It's much better now. What do you tell people?
Yes. If everybody in your family is vaccinated, you can safely mingle without socially distancing. You can kiss your grandma. Now, because children are not vaccinated, okay?
Right.
What we recommend is that if the older people are vaccinated and they invite one household with unvaccinated people over, it's perfectly fine and reasonable.
Okay.
So if the parents have been vaccinated, the grandparents have been vaccinated, the kids have not been vaccinated, that is perfectly fine. And if you invite the cousins over that haven't been vaccinated, that's okay.
Good to know.
If you go into bigger scenarios, I would strongly recommend for everybody to wear a mask, whether vaccinated or not.
Right. But household gatherings, grandma, mom, people are going to be very happy to be back this year celebrating Mother's Day. So
understandably so. It's about time.
Yeah, it really is. Dr. Ansorg, thank you so much. We appreciate you joining us. We do this every week here on Midday on Thursday, kind of a longer conversation to get your COVID questions answered. So we appreciate your time.
Of course.
All right, well, COVID-19